Hi there, my name is Dr. Nicole Siegfried, and I'm a licensed clinical psychologist, and I hope you find this video helpful.
Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after experiencing or witnessing a terrifying or traumatic event. A traumatic event is something that causes intense fear, helplessness, or horror. It can be a single event, like a car accident, natural disaster, or assault, or it can be ongoing, like domestic violence or combat. Not everyone who experiences a traumatic event will develop PTSD. However, for some women, the effects can be long-lasting and have a significant impact on their lives. Approximately 8% of women will have PTSD at some point during their lives. Anyone who experiences a traumatic event can develop PTSD. However, women are disproportionately affected. Women can be more likely to develop PTSD because they can be more vulnerable to certain types of abuse, and stereotyped gender roles may increase the negative impact of trauma experienced. Women can also face additional strain on their gendered social role and stress reactions. Examples of traumatic events women may experience include sexual assault. This is one of the most common causes of PTSD in women. The physical and emotional trauma of a sexual assault can have long-lasting effects on women. Next is domestic violence. A woman can develop PTSD if she experiences physical, emotional, or psychological abuse by an intimate partner. Also, child abuse. If a woman experienced physical, emotional, or sexual abuse as a child, her risk of developing PTSD in life increases. Also, witnessing violence. Seeing violence such as domestic violence against a loved one or community violence may also contribute to PTSD. Next is sudden death or illness. The sudden, accidental, or violent death or serious illness of a loved one can trigger PTSD. Also, natural disasters. Women can be more affected by natural disasters and be at higher risk for PTSD. Next is accidents. Serious accidents like a car accident or workplace injury can be a trigger for PTSD. And also, war. Being exposed to war or combat as a civilian or through military service can cause PTSD. So let's go over some risk factors for PTSD in women, which can include early childhood trauma, lack of social support, other mental health conditions, substance use, the type of trauma, or the length and severity of trauma. Not all women who experience these traumas will develop PTSD. However, it's important to seek help if you believe that you're struggling with PTSD. Women can be more likely to wait to seek help for their PTSD symptoms and can delay an average of 4 years. So what about symptoms? PTSD symptoms can be different for everyone, but some common symptoms in women include flashbacks, nightmares, intrusive thoughts, avoidance tendencies, hyperarousal, mood changes, or physical symptoms like chronic pain, fatigue, headaches, or sleep problems. So how is PTSD in women diagnosed? If you suspect you or a loved one is experiencing PTSD, please seek help from a mental health professional or healthcare provider. To receive a PTSD diagnosis, they'll complete an evaluation that might include your detailed medical history, a review of your symptoms, and a delicate discussion of your traumatic event. There isn't a specific test for PTSD, but a diagnosis will be based on the Diagnostic and Statistical Manual of Mental Disorders. So how is PTSD in women treated? There are several effective treatments for PTSD. The best treatment plan will depend on your individual specific needs and symptoms and may include one or a combination of the following. First is therapy. Therapy can provide a safe space to process your traumatic experiences. It can help you learn the tools and gain the support you need to heal. Your therapist may use a combination of evidence-based techniques to address the challenges posed by PTSD. Some of those effective techniques might include the following: cognitive behavioral therapy. CBT can help you identify and challenge negative thought patterns related to your trauma. Also, prolonged exposure therapy. This can involve gradually confronting trauma-related memories, thoughts, and feelings in a safe and controlled environment. They might also use eye movement desensitization and reprocessing, which is known as EMDR. This involves focusing on traumatic memories while following a therapist's finger movements. Next is trauma-focused cognitive behavioral therapy. This specifically addresses the needs of those who have experienced trauma. Also, they might consider medication. Medications can help manage the symptoms of PTSD and are often used in combination with therapy. Common medications prescribed for PTSD in women include antidepressants, anti-anxiety medications, or sleep medications. Your treatment plan might also include support groups. Getting connected with others who have had similar experiences can be helpful in managing PTSD in addition to therapy and medication management. In a support group, you'll have a safe space to share experiences and learn from others. This can provide you with a sense of community and understanding. Also, self-care. While professional treatment and therapy or medication management is essential, it can also be beneficial to practice self-care. Self-care practices that can help you in your PTSD recovery include regular exercise, a nutritious diet, adequate sleep, or relaxation techniques. So what are some complications? If left untreated, PTSD can have a significant impact on a woman's life, including difficulties with relationships, possible substance abuse, physical health problems, or suicidal thoughts or behaviors. It's important to remember that healing takes time and is not linear. Asking for help with PTSD is a sign of strength, not weakness. Be patient with yourself during your healing journey, and give yourself grace when you experience setbacks, and celebrate your accomplishments. Seeking support from your loved ones, friends, and professionals can help you. Managing PTSD and thriving is possible with the right treatment. It can be a challenging journey to live with PTSD, but you don't have to face it alone. At Lightfully, we understand the unique struggles women can experience living with PTSD. Our deeply compassionate experts offer a supportive and understanding environment where you can begin your healing journey. We use a unique framework created from components of evidence-based techniques to create a personalized treatment plan to provide you with whole person-centered care. This approach allows us to address the physical, emotional, and psychological aspects of PTSD, which can empower you to heal and thrive. Recovery is possible, and we're committed to walking alongside you along your path to healing. Change is possible. When you're ready to take the first step, reach out to our admissions team. We'll take the next steps together towards the fullest, brightest version of you.